South Dakota Senator Tim Johnson's emergency brain surgery, of course, focuses the spotlight on arteriovenous malformations, or AVMs. This is a defect of blood vessels that people are born with, and they can occur anywhere in the body, but they're most dangerous in the body's nerve center, in the brain.
300,000 Americans are living with AVMs, tangled webs of blood vessels that most often don't cause problems.
When the blood vessels are being formed, they just don't divide or form themselves in the proper way.
Endovascular neurosurgeon Dr. Demetrius Lopes says people may have no symptoms at all or minor symptoms such as dizziness or mild headaches. Most often, AVMs are discovered during autopsy or when treating another disorder through CAT scans or MRIs. If found, there are ways to treat them. Among the newest,
we can do treatment with what we call embolization, which is placing a glue inside of the vascular malformation and sealing those blood vessels that are malformed.
Other options include radiation and surgery, but the risk of complications can be as high as 12%. Surgery is the only alternative when an AVM ruptures and causes bleeding on the brain, as happened with Senator Tim Johnson.
It's a type of stroke when you have a bleeding like that.
Now, the degree of damage an AVM can cause depends, of course, on the location. Not only can the mass cause bleeding, but it can choke off oxygen supply to other parts of the brain. And so essentially what the senator is recovering from is like a stroke. I mean, it is in fact a stroke. It's not a blockage stroke, it's a bleeding stroke. And these are very individual, as we've seen with many cases. And so it's just impossible to predict what kind of damage he could have, how long it could take him to recover.